Hello friends, today we are going to talk about sepsis. In this video we will cover Introduction, Stages of sepsis, Symptoms of sepsis, Causes of sepsis, Effect of sepsis, Diagnosis of sepsis, Treatment of sepsis. So let's get started. Sepsis. Sepsis occurs when your immune system has a dangerous reaction to an infection. It causes extensive inflammation throughout your body that can lead to tissue damage, organ failure, and even death. Many different kinds of infections can trigger sepsis, which is a medical emergency. The quicker you receive treatment, the better your outcome will be. What are the 3 stages of sepsis? Healthcare providers used to organize sepsis into 3 stages: sepsis, severe sepsis, and septic shock. Now, they identify the condition on a more fluid scale. This scale ranges from infection and bacteremia, bacteria in your bloodstream, to sepsis and septic shock, which can lead to dysfunction of multiple organs and even death. What are the symptoms of sepsis? Sepsis can affect many different areas of your body, so there are many possible symptoms. If an infection such as blood poisoning, septicemia, triggered your condition, you may develop a sepsis rash on your skin. The rash makes your skin appear red and discolored. You may see small, dark red spots on your skin. Other common sepsis symptoms include urinary issues, such as reduced urination or an urge to urinate. Low energy/weakness. Fast heart rate. Low blood pressure. Fever or hypothermia, very low body temperature. Shaking or chills. Warm or clammy/sweaty skin. Confusion or agitation. Hyperventilation, rapid breathing, or shortness of breath. Extreme pain or discomfort. What causes sepsis? Bacterial infections are one of the most common causes of sepsis. Fungal, parasitic, and viral infections are also potential sepsis causes. You can get sepsis when an infection triggers a chain reaction throughout your body causing organ dysfunction. The infection leading to sepsis can start in many different parts of the body. Common sites and types of infections that can lead to sepsis include respiratory system. Infections involving your lungs, such as pneumonia. Urinary tract system. Urinary tract infections are especially likely if you have a catheter. Gastrointestinal system. Infection of your appendix, appendicitis. Bowel problems. Infection in your abdominal cavity, peritonitis. Gallbladder or liver infections. Central nervous system. Infections of your brain or spinal cord. Skin. Bacteria can enter your skin through wounds, inflammation, or openings made with catheters and IVs. Conditions such as cellulitis. Inflammation of your skin's connective tissue. Who does sepsis affect? Sepsis can affect anyone, but people with any kind of infection, especially bacteremia, are at a particularly high risk. Other people who are at a high risk include people older than 65 years old, newborns and infants, and pregnant people. People with medical conditions such as diabetes, obesity, cancer, and kidney disease. People with weakened immune systems. People who are in the hospital for other medical reasons. People with severe injuries, such as large burns or wounds. People with catheters, IVs, or breathing tubes. How is sepsis diagnosed? It's very important to quickly identify people with infections that may go on to develop sepsis. There are no strict criteria to diagnose sepsis. That's why providers use a combination of findings, from a physical exam, lab tests, X-rays, and other tests, to identify the infection, blood cultures, and diagnose sepsis. How do you treat sepsis? Sepsis treatment needs to begin immediately. The most important concern in sepsis protocol is a quick diagnosis and prompt treatment. If your provider diagnoses you with sepsis, they'll usually place you in the intensive care unit, ICU, of the hospital for special treatment. You may receive the following treatment. For sepsis. Antibiotics. You'll receive antibiotics if you have a bacterial infection. Homeopathic treatment. Homeopathic treatment focuses on the patient as a person, as well as his pathological condition. The homeopathic medicines are selected after a full individualizing examination and case analysis, which includes the medical history of the patient, physical and mental constitution, etc. Some of the proven remedies for sepsis are: homeopathy remedies for sepsis. Arnica, lachesis, phosphorus, pulsatilla, arsenicum. Thanks for watching. Doctor Online 24/7 by Dr. Sana Bawani.